Quick update on how I'm doing. Hope everybody is doing okay this morning. Um, it's actually kind of a nice morning right now, but it's going to get hot and humid pretty soon, so I'll probably be inside the house most of the day. Um, I went to the doctor, the pulmonologist. I don't like him. He was actually better in the hospital than he is as a private doctor. He told me to scan my cat. He told me my cat was better off dead. He told me to get rid of my cat. I'm not allergic to my cat. What happened was, I went off my methotrexate. The whole time I was on methotrexate, I've been asthmatic since I was 5. I'm used to, when I live humid and hot outside, I have a lot of asthma. I have asthma flares. The weather has always affected it. Animals have never really affected my asthma. And with little they do, my allergy pill kicks in and takes care of. Um, Otherwise, I would not have them. Anyway, he told me that, I told him I could get some dander shampoo. We've done that before, um, just to keep the dander down. And he says, well, if the cat's already dead, you don't have to keep the dander off of it. And I'm like, what? Really? You said that to me about well, basically, I have no kids and I'm not married, so they're my babies. You said that about my babies. That's not right. Um, but yeah, and he ordered a bunch of unnecessary tests. He wants me to have a sleep apnea test, a sleep study. I don't have sleep apnea. I know I don't have sleep apnea. Um, my mom has slept next to me in the hospital enough that we would know if I had sleep apnea. I've been in the hospital enough times in the last few years to know if I had sleep apnea before now. Um, I've been able to go without this on and off. We're going to try and lower it to 2 on my mom's 2 days off to see how that goes. Um, this morning, I've been hitting the 2,500 on this, but I hit 3,000 this morning, so my lungs are getting stronger. I've never hit 5,000 ever. Asthmatics don't usually hit 5,000. People with lung issues, as you know, don't hit 5,000. It just doesn't happen. Um, but 3,000 is, I've never hit 3,000 before, so that's awesome. He's also ordered me to have an EpiPen because I had 2 severe asthma attacks. I went off my methotrexate to get my toenail removed, and I ended up not getting the toenail removed because within the 3 days that I went off the methotrexate and it started to dissipate from my system, I started having mucus plugs. I started getting sick. I had pus coming out of my toes. I had all sorts of problems that I had never had before. Lots of little infections that we had no idea I had were agitated and aggravated by this methotrexate. I'm not taking methotrexate anymore. I just about given up trying to find any other medicine besides the steroid. I don't care what it does to my blood sugar. I don't care what it does to my blood pressure. It works for me. The medicines have managed all of these symptoms. And when I get off of it for a while and when I go into remissions and stuff, everything regulates. It's not a problem. I don't have an issue with this. I don't know why everybody else has an issue with this. Telling me I'm more suppressed on steroids than I am on another medication because I'm not. Not for me. It works for me. And aren't you supposed to, wouldn't it, the hypocrite's oath or whatever? The Hippocratic oath, I know, but I call it the hypocrite's oath. Because so often that they deter from it. First, do no harm. If it's not doing harm, like tons of physical harm, I don't have any cancers, I've never had any other problems with just a regular dose of steroids. My blood sugar is actually even, it was like 69 last night, so it's not going high. It goes the highest in the afternoon at lunchtime. It's about 100, 120, which is actually within the normal range. Most doctors let it get up to 130 before they do anything about it. So I'm actually not even going above that line. Um, I'm just gonna tell my doctor, my rheumatologist, the next time I go see her in September. Um, I'm done. I don't want Rituxan. I don't want anything else. I don't want the risk of dying. I'm gonna just lay it out on the table, and if she doesn't like it, then I want a referral to somebody who does. Because I'm not taking any more drugs that suppress my immune system to the point where I can't even feel myself having an asthma attack and build up all these. It takes so long to build up a mucus plug that big. That is what my doctor told me. She suctioned out of me was a mucus plug that big in my airway, right here, in my chest. Right here where Pebble's head is. I got my really old footstep shirt on this morning. There's Fred and Barney and all that. I got to take the yard sale. It was like brand new. And I've had it so long, there's like holes in the shirt. They're just everywhere. But, yeah, and he also, that doctor, the pulmonologist, he also ordered an EpiPen. I've said that, I know. He wants me to try this Xolair, which I inject, which is an immunosuppressant. How, if you're suppressing your immune system, are you supposed to have a proper asthma attack? I don't get me wrong, I don't like having them, but I'd rather have a regular asthma attack than whatever the hell it was I had in the emergency room, in the ambulance on the way to the hospital. I'd much rather have a regular one, get over it, and go on with my life. I used to, I don't like them, but they can be controlled with Advair and stuff, and I don't know why he didn't give me something called Brio. I looked that up. It's a COPD medication. I don't have COPD. He wouldn't listen to a thing I tried to tell him about my symptoms. Nothing. Not a thing. And a doctor that doesn't listen is no good to any of us. So if you're ever in the Kansas area and you need a pulmonologist, please do not go see this doctor. And I will, if anybody wants to know who he is, I will post it in the group. Because I really don't want to badmouth the doctor and get sued for slander. So yeah, that's my rant of the morning. I'm just sick and tired of these doctors thinking, well, I'm a rare case, so whatever basic symptom I have, we can't treat it normally. We have to experiment. I'm not everybody's freaking guinea pig just because I'm the one person in the whole area that doesn't comply to the rules of medicines. I'm a rare case. I don't have normal side effects. I have the most extreme and the rarest side effect there is, usually. And I've learned to live with that. But, and I'm sitting here, my cat is in here. I've had my cat on my lap. I haven't had any kind of respiratory effect. I'm still a little hoarse from the vent, but, like, my voice is much stronger, as I'm sure anybody that's ever been on a vent can tell. It's much stronger than it was. I'm happy with the improvement. Be happy to ditch this thing. Of course, it's better to have it and not need it than to need it and not have it. But I think I'm getting to the point where I really have it and don't need it. At least for a while. I mean, like, if I'm really active, it still kind of gets to me. So it's nice to have it for that. But, I mean, asthmatics get out of breath anyway, and easily in humid temperatures like that. Our humidity yesterday was like 80% or something. It was terrible. And I was like flared up. And when you're flared up, for somebody that doesn't understand what that is, it's not like our muscles being flared up. It's like the lung muscle is totally flared up, and it feels like your chest is an inflated balloon inside of your body. And you're like this all the time. Inside, that's what it feels like. But outside, you're like breathing normal and everything else. It's really hard to deal with that and not overinflate, because if you overinflate bronchial tubes and stuff, lots of things can get down in there, and you can have problems such as pneumonia and upper respiratory infections, and you just got to really, really watch. And I've had that for so long now, I know how to deal with it, you know. You have a sudden asthma attack, use one of these. This is albuterol, well, it's probenol, but it's an albuterol inhaler. And if you have a lot of congestion, you use one of these. It's a nebulizer. And you just turn it on, you hook everything up, you pour your medicine in there, you turn it on, you start inhaling. You smoke it like a peace pipe. In fact, that's what my little brother, when I was little and I had my first breathing treatment, he would say, "What's wrong with Sissy?" And my mom would tell him, Sissy's smoking. Sissy's smoking her cigarette. Because my mom smoked, and she always smoked outside. She never smoked around me. She also had one of those smokeless fans that she used in the kitchen, like when it was too cold outside to go out, or too hot. And it really never affected me. We have a lot of asthmatics in the family, and I just ended up getting that special fun gene too. This puts me twice at double the risk for lung complications with the poly. So I've heard. So far, knock on wood, I have not had a problem, but I'm hoping and praying to God that keeps on going and staying the way it is. And I hope this keeps improving, and as always, I pray for you guys every day, and I always hope you guys are doing good, and it makes me sad to see when you guys aren't doing well. And, I'm just glad to see that here lately everybody's been doing pretty well. So, keep on keeping on, y'all.